Hi, folks. AJ Heitman here, editor emeritus at GEMS and your host on the EMS Today show. Welcome to the show today. It's not a show where I usually do any kind of product demos, but there's a new product that's come on the market that will allow us to treat patients that we haven't in about 13 to 14 months. And that's the asthmatics and others that drastically need nebulized care. So with me today is Dr. Paul Lewis, who represents AerosoLess Medical of South Florida. They've recently released a revolutionary new face mask that allows medical personnel to, again, provide nebulized treatment. So hi, Dr. Lewis, how are you?
Good morning, AJ, and thank you so much for having me on today. I really appreciate you taking the time to talk about this product.
Well, you're welcome. I got the product release, and then I heard from Dr. Antevi that he did some research on it, and then I called you, we discussed it, and I was writing up the article that will accompany this show, but also be sent out on GEMS. But I thought that we should get together to talk about the mask and hear a little bit about what the whole genesis was behind it. But first, tell us a little bit about yourself.
Well, okay. So I was born in South Africa. I was raised in America and went to medical school in the University of Miami. And I did my training in emergency medicine in New York City. And I'm currently board certified. Most of my career was practicing in South Florida. And I'm doing a temporary stint in California in Salinas.
At Natividad Medical Center, is that correct?
Natividad Medical Center.
Great. Well, I mean, welcome to California. I can either say that or sorry that you had to come to California. Great weather, but it's very strange, particularly right now.
Yeah.
You know, I've been a paramedic for a long time, and I've treated a lot of patients that had asthma, emphysema, et cetera. And to hear that crews now can't give albuterol, Atrovent, and in the case of airway bleeding, some ERs use TXA and some helicopter programs use TXA. But this is really not about the nebulization. This is more about the structure. And the thing that fascinated me was the structure and the ability of your mask to keep a seal. So talk to me a little bit about the genesis of this. I know you had an engineer involved with you.
Yeah, well, I'm going to start off with March 2020, when I was working in an emergency department in South Florida, a Baptist emergency department. We received a rescue patient brought in with severe COPD, and she was clearly wheezing. And I noticed that she wasn't getting any nebulized treatments. And I said to the paramedics, "Hey guys, how come you didn't give her albuterol?" They said, "Oh no, that's been removed from our protocol." And I realized exactly what they were talking about. Aerosols, no more aerosols. And I thought, wow, that's like trying to treat a patient with your hands tied behind your back.
Yeah.
Yeah, AJ, I'll tell you, I'm an asthmatic. And my asthma has been activated pretty strongly for the last 2 years, unfortunately. It's really pretty bad. But one thing that I know I keep at home now, since I'm a physician and I know what I need, is I have a nebulizer machine. My go-to in the beginning is to use an albuterol or a rescue inhaler, and I always use a spacer with it.
Right.
You know, that's my setup right there, the albuterols and spacer setup. But when I'm really tight, I need to go to the nebulizer. And the same applies for most asthmatics and most COPD patients. So if they're calling EMS, if they're saying, "Hey guys, I need help, I'm short of breath," they're not expecting to, you know, get an MDI and spacer. They want albuterol, they want successive treatments, and they want to feel better. And most importantly, the paramedics want to actually help them. All my friends who are paramedics, they are in this to help patients. And then I just put my kind of thought process together. We talked to the engineer, my engineer friend, who's now my partner, and we realized that the whole problem are these ports in the face mask. these ports release fugitive emissions into the environment. And these are potential contaminants to frontline workers. And it's particularly important when it's in confined space. So we came up with a concept of covering these ports with filters. We then realized that the path of least resistance for the exhalation for the patient breathing out is going to be around the area between the mask and the face. So we had to combat that resistance, and we came up with what we call the faceplate, and we'll talk more about it, but the whole concept was trying to create a filtered mask with a very a CPAP-like seal.
Yeah, and I have one here, as you can see, and I was pretty impressed, I got to tell you, because when you sent me the samples and I began to play with them, the first thing I noticed that the packaging and everything was very user-friendly. It was very clear to me that this was the AerosoLess Mask, and when I took it out and I looked at the faceplate, I saw that that's the ingenious part of this whole thing, because it really does force the mask against your face. And I say that in a delicate way because it's very soft and comfortable. And then you have these absorbent pads here. But what impressed me is that in every mask when it came out was the notice that these are nasal pad seals. Don't remove them. So then I saw that you had a stick-on decal, which showed me all the parts. It include the faceplate, the strap, etc., and most importantly, the strap lock knot right here. So ingenious is the viral coverings on both sides. Yes, that's great. The absorbent pads here for any moisture that comes out. And then when you put the mask on, I'm going to be sorry for the audience. I'm going to be a little dull here, but when you put the mask on, it's very comfortable. And like other masks, as a provider, you're going to pull it snug. But once you pull it snug, you have these notches here that the straps fit in, and take the mask away to talk. And then that locks it in place, kind of like a CPAP. And I found it to be very comfortable. And really, tell me if I'm wrong, this is the secret to the mask, is the structure.
That is the secret sauce. That is correct.
Yeah, and the rest of it is just, hey, I've done this before. The O2 tubing is included, and hook it up, put your medication inside, and also inside was really ingenious as well. And this would be great for crews is directions for use. And I want to go through these. Obvious oxygen flow rate at 6 to 8 liters to give nebulized. Do not exceed 6 cc's of medication, 2 doses, as the filter will become saturated. And don't use it for longer than 15 minutes because the filter will become saturated. So you're telling them right up front, this is an adjunct to your other PPE, and don't overdo it. So after 15 minutes, I'm assuming they would use a different mask. Am I right? They'd use another one of these.
Right. So there's a couple things about this. One is we did research, and if you take a regular face mask, we talked about the concept of fugitive emissions, the gases that come out of the regular face mask. And this is basically wasted medication. So when you give a patient 3 or 6 cc's of albuterol or albuterol Atrovent, remember, most of that's going out, not most of it, but close to 50% of it is leaving the mask and not going to the patient. The AerosoLess SafetyNeb mask is a closed system. So almost all the intended medication is going to the patient. So just keep that in mind, that the patient is going to get more of the intended medication that you as a paramedic are giving the patient.
It goes on here and says, hold the mask by the faceplate so you avoid contact with the filters.
That's right.
It says place the mask and faceplate on the patient's face with the elastic strap around the ears, and then pull the ends of the elastic strap snug until the mask contacts all facial features and slide into the lock slots. apply pressure to shape the metal nose piece. And again, this is something that you can peel off and actually place somewhere in the ambulance or in your respiratory bag so that it's available to you. So I think though the packaging is really good. Let's talk a little bit about the research, because I know Dr. Peter Antevi is a name that everybody in our audience knows. As soon as I heard from Dr. Antevi, AJ, you should look at this product, as I did research on it before I put it on my rigs. I said, oh boy, if Dr. Antevi likes it, AJ's going to like it, and the crews in the field are going to like it. So he and Dr. Stephen Rios, I think it is, found that while the regular oxygen masks emitted a significant amount of particulate matter into the air environment and the confined space of an ambulance patient compartment, the SafetyNeb mask released, he said, only negligible particulate matter measured through use of a particulate counter. Now, I know some of the videos that you've shown have used a green light laser to show that a regular mask emits a lot of stuff into the atmosphere and that your mask does not. But talk about a particulate counter, because that's really the science one, isn't it?
That is the science behind it. Well, this is what they use in, to detect clean rooms, to make sure that there's nothing in the room. So these are pretty expensive equipment, computerized equipment with lasers and these ports that basically measure channels of different size particles. So it can be 0.5 microns in size, 1 micron in size, 3 microns in size. And so in every room, people are super aware of aerosols now, right? So when we got this thing, you put it on your room like, oh my God, what's in my room? All these particulate matters. Oh, there's all this particulate matter. So probably an average room in a house is like, 50,000 particles of 0.5 micron in size. And it's amazing. You just put it on everywhere. It's like, oh my God, this stuff's around the environment. So,
well, I thought about this a lot last night before we came on the show this morning. And if I was still an operations director, I think that my protocol would be to carry multiple of these in the respiratory bag and put one on the patient in their home or wherever you find the patient who's an extremist that needs this, because that's why they're calling you. They've already gone past their own NEB. And then once the ambulance gets en route to the hospital, which is less than a 15-minute ETA in most cases, take the first mask off and put a new mask on, put a fresh one on.
Yeah.
And place this in a biohazard bag, etc. We're going to have some videos attached to this production. I'm not going to belabor it right now, but I do think that the next thing I want to talk about is cost, because everybody always worries about cost. This is going to price with some of the major distributors around $10. Am I correct?
That's correct. Yeah.
Compared to 100 plus for what the hospitals are using now, which are rescue inhalers with spacers. Could you address that a little bit?
Yeah. So there's a couple of things we should talk about. One is the Mdi Spacer. Now I know there are studies that show that the Mdi and Spacer is equivalent to a nebulizer. It's just not my experience as an asthmatic. And I would tell you, if you ask most people that are COPD patients or strong asthmatics, they'll tell you the same thing. The second thing is, what are people, I'm going to get to a little bit what you're talking about, but I want to just address what other people have been doing. They've been using these peace pipes and they attach a viral filter at the end of it. Now, the problem with this device is it's well-intentioned, but it's ineffective.
How so?
It's only as effective as your patient breathing all their exhaled pathogens into that mouthpiece. And if they do so, then it will be filtered. But we all know that if a patient is getting a respiratory treatment, they're probably breathing outside the mouthpiece, and almost all people that have bronchospasm, when they're tight, when they start to open up, they start to cough. I just gave myself a treatment now before I came on the show because my asthma has been bad, and I was coughing like a madman. And you cough around the thing, and then all the intended protection for the paramedics is lost. So this is just something that is kind of smoke and mirrors for protection in my mind. You asked me about the cost of the mask. The mask is about $10. If there's a large volume EMS agency, there's graduated discounts. The product is made in the USA. It is made with precision application of the filters. It's not done with some, with Asian knockoff filters or it's done with people that really care about safety. And so that's super important to know.
And it's patent pending right now, but that's just a given.
Yeah,
right?
absolutely. Yeah.
And I know that the various folks, the distributors, are very excited about it because they know it's a market that has not been able to be hit for 13 months. And I commend you for bringing it to market in really less than a year. Yeah. Wasn't it November that this started to become available?
It took us 6 months, and we have it in use in EMS agencies, several EMS agencies around the country.
Well, I have a sister-in-law who's an asthmatic, and I can't imagine from her home. She lives in a rural area in Pennsylvania, and it's probably a good 30-minute ride to the hospital. For her to be an extremist and have no care, nothing to be allowed, and some services don't even allow people to use their own inhaler when en route to the hospital, this could really be a game changer. I want to say a lifesaver, but it will be a lifesaver.
Interestingly, we've had, now just to be clear, the primary indication for the mask is for bronchospasm. So it could be asthma, COPD, acute bronchitis. That being said, it is for people that do not have COVID or people that have COVID. Mostly, if you think about it, when a paramedic brings a patient and from an unknown patient into their confined space, and that patient has a pathogen, today we know it's COVID. We don't know what it's going to be tomorrow. This strain of that, the other strain. It could be that first patient that comes into that confined space and they start coughing. This is an opportunity to treat that patient and yet protect themselves. What I was going to say is that, interestingly, you say it's a lifesaver. And I've had anecdotal experiences, even though it's not only intended for COVID patients, of respiratory therapists that have reported to me significant improvement in oxygenation in their patients when using this mask over high flow, over other modalities that they used.
And something that we talked about this yesterday on the Metropolitan Medical Directors meeting, because I wanted them to hear about it as well. And Dr. Antevi is one of our Eagles, the AKA Eagles, because they're, that's what they're known as. And I think one of the important things that he said online was that he is studying every use of this with his people so that when they use it, and they don't use it that often, but when they need to use it, he's going to test that crew to make sure that they have not, become sick or COVID positive or whatever. So the fact that he is such a brilliant guy and is got our backs by doing that kind of research, which I will certainly publish if he gives that to me, is really important. So I think you have a game changer here, and that's the reason I wanted you on the show.
Thank you.
I really want to thank you so very much for developing this. And I didn't know when we were talking that you were an asthmatic. So your modus operandi is good too, because it's something that I'm sure you have at home now too.
I absolutely do.
To maximize it. So the patient compartment can be safe. That's the most important thing. Anybody can sell you an aerosolizer, and anybody can do the old tap on their mask and see that steam or whatever you want to call it, that the exhaled air is coming out. But when you look at the video, you'll see that when this is on properly, this is a face mask that's an adjunct. It's a PPE adjunct that helps save your life and help save the patient's life.
Yeah.
Again, thank you so much for coming on today, and we'll follow up on the progress of your product.
Thank you so much, AJ. It was really great. I really appreciate your time.
You're quite welcome.